Hello, my name is Rayhan Firdaus bin Rusli, metric number BR22110016, and welcome to our presentation on prolapse of vagina and uterus. Today, me and my group members Arvindran and Tariq will present on prolapse of uterus and vagina. The content of our presentation are: firstly, what is prolapse in animal reproduction; second, how to identify symptoms or signs of prolapse; third, management and treatment options; fourth, prevention strategies; and lastly, conclusions. So, for my part is introduction on prolapse of vaginal and uterine. So, we will look at the definition and overview of vaginal and uterine prolapse in livestock. A prolapse is defined as the falling down or slipping of a body part from its usual position. Vaginal or cervical prolapse are two types that occur in beef cows. The complete uterine prolapse is the most common at calving. This is when the uterus is completely expelled out behind the cow and can hang down to the hocks when standing. This condition can be life-threatening for the cow, and the uterus must be cleaned and reinserted as quickly as possible. The cow can go into shock quickly and die from blood loss. Cervical prolapse is usually seen in older cows and occur when the tissue around the birth canal becomes relaxed during the later stages of pregnancy. The increased pressure in the abdominal cavity will push the vagina or rectum out. If there is tissue trapped outside the birth canal, it can swell and become infected. The bladder can also be trapped in the expelled tissue, preventing the animal from urinating. So, what is the prevalence and economic impact on livestock operation? Prolapse can have a substantial economic impact on beef cattle operation due to several direct and indirect costs. So, for direct costs is firstly veterinary expenses. Immediate veterinary care is required for treating prolapse, which can be costly. Emergency call-outs, surgical intervention, and follow-up treatments contribute to these expenses. Secondly, treatment costs. Medication, sutures, and other supplies needed to treat and manage prolapse add to the financial burden. Third, labor costs. Additional labor is often needed to monitor and care for cows experiencing prolapse, especially during calving season. And on to indirect costs. First, reduced productivity. This can be seen on lowered rebreeding rates. Cows that experience prolapse may have reduced fertility or difficulty rebreeding, leading to fewer calves born in subsequent seasons, and delayed calving. Prolapse incidents can delay the calving schedule, affecting overall herd productivity and synchronization. Second, increased cull rates. Cows that have had prolapse are often culled to prevent recurrence, leading to increased replacement costs and potential loss of genetic progress. Third, mortality. Severe prolapse, especially uterine prolapse, can lead to death of the cow if not treated promptly and effectively, resulting in the loss of valuable livestock. And fourth, genetic impact. Prolapse-born bloodlines may be excluded from breeding programs, potentially leading to a reduction in genetic diversity and selection options within the herd. And next is understanding the predisposing factors for vaginal and uterine prolapse in beef cow is crucial for effective management and prevention. Several factors can increase the likelihood of prolapse, including age, parity, breed, nutritional status, and forced extraction of offspring. And that's it for me. Thank you.
Hi, Assalamualaikum. So I am Tariq. So now I will continue for how to identify the symptom or sign of prolapse. So as we know that there are two different types of prolapse, which are vaginal and uterine prolapse. So actually these things can happen or repeat on animals, and actually if get too serious of prolapse, the animals could be dead. And also the symptom or sign of animal having prolapse are such as the animal looks very weak, and then also depression will come over the animals, and also the animals will have abnormal body temperature compared to usual condition on animals. Also, the symptom of sign of animals having prolapse also can be coma, and the animals will looks very struggling to continue any movement or doing anything in movements, and also prostration. So refer to the next slide. So now this is how it looks like, the differences between vaginal and uterine prolapse. So figure 1, the black angles cow with vagina prolapse, as we can see here, with the small ball like looks like a ball at the behind of the animals, while at figure 2 the black angles with the uterine prolapse have like more bigger meat came from the back parts of the animal, which is from the vagina. So this is the actually comparison between vagina and uterine prolapse. So next slide also show us the vagina and uterine prolapse comparison. So we can see here that vagina looks not very serious, but also need to be taking care by the farmer. But the uterine prolapse, like is a very serious things, which the uterine came out from the back parts of the animals, and here farmers need to take a very serious action, which is to get help from the veterinarian and not to take action solely to maybe minimize costs, but please find an alternative to help the animals.
Thank you, Amatari. Now I would like to present about management and treatment options. There are two. So firstly, I would like to talk about replacement and retention techniques, which is obstetric repair. It's known as surgical intervention to reposition the prolapsed uterus and repair any tissue damage. Storing, which we are placing stitches to close any laceration and maintain the uterus in proper position. And for truss and harness, using supportive device to hold the uterus in place and prevent further prolapse. These techniques focus on physically correcting the prolapse and preventing recurrence through surgical intervention and external support. So the other management and treatment options are medical therapy, which is we are giving antibiotic, which is administered to prevent or treat any bacterial infection associated with the prolapse. So for anti-inflammation drugs, which are given to the female cows to reduce inflammation and swelling in the affected tissues. So for example, calcium and hormone injection, which are used to help strengthen the uterine muscle and promote healing. Medical therapies aim to address the secondary issues related to the uterine prolapse, such as infection, inflammation, and weakened uterine muscle. As the diagram below shows, example medicine especially for female cows. And I would like to talk about prevention strategies. So for prevention strategies, I would like to talk about proper nutrition and minerals supplement, especially for female cows, ensuring that the animal receive a balanced diet to dedicate nutrients and minerals, supplementing the essential minerals such as calcium to maintain uterine muscle tone and strength. Proper nutrition and mineral balance are crucial for maintaining the overall health of the animal and prevention uterine prolapse. And the other part of prevention strategies are skilled obstetrical assistant during parturition. This skill we will hire veterinarian doctors or veterinarian staff to ensuring that trained personnel are available to assist during the birthing process, providing prompt intervention and support in any case complication or sign of uterine prolapse. Having skilled obstetrical assistant on hand during the parturition can help identify and address any issues quickly, reducing the risk of several uterine prolapse. And the last part is conclusion. I would like to know, in conclusion, uterine and vaginal prolapse in female cows is a serious condition that requires prompt attention and management. While surgical interventions such as obstetrical repair or storing may be necessary for several cases, such as medical therapies with antibiotics, anti-inflammatories, and calcium hormone injection can also play a crucial role in treating the condition and promoting healings. Prevention strategies including proper nutrition, controlled breeding programs, avoidance of overconditioning, and skilled obstetrical assistance during parturition are essential for minimizing the risk of prolapse, especially for female cows. Timely intervention, appropriate treatment, and effective prevention measure are key to maintaining the reproductive health and overall well-being for female cows and ensuring successful calving outcomes. That's all from me. Thank you. For further more information, you can refer our reference given. That's all.